at some point in everyone's life, we're gonna need you for something. And we don't know when and exactly what that's going to be, but we need you, and thank you for being there. We really appreciate you. I'll just tell you a little bit about myself. I'm a psychologist. I practice in the DC area for nearly 30 years now. I'm author of 7 books, and I am also a media consultant, and I speak on television, radio, documentary film about women and alcoholism called Lipstick and Liquor. And so I've done a lot of work with the public. One of the things that I have seen that is so incredibly positive is that the stigma around talking about mental health issues and addiction has gone down quite a bit. I'm a person in long-term recovery myself. I've been sober for 36 years, and when I first got sober, it was a different world. There was not as much openness about talking about addiction and recovery, and I got sober in March of 1990, and I remember that year, one of the things that really influenced me a lot was an article in Vogue magazine, which I used to read. It was a lot of fun back when we had magazines, and there was an article about all the movie stars in Hollywood that were getting sober, and it became like this fashionable thing. And seeing that people I liked and admired were getting sober and getting help with mental health was a great inspiration to me, and it kind of gave me permission to be part of this crowd and the community. And I found that in Washington, D.C., where I live, the community was amazing. Like, the people there were the real winners of society, the smartest, the best, and the brightest. And when I became part of that community, I started meeting people that I had never even dreamed I would ever be able to know, and seeing what they were doing with their lives, and that also gave me a lot of great inspiration. I guess about 8 years after I got sober, I got married. My husband was also in recovery. We met in recovery, and he was the chairman of psychiatry at what is now Walter Reed. And so he was the psychiatrist to Congress, Senate, Pentagon, and the White House. And a group of us one day went to the Capitol, and we testified for the parity bill. And the parity bill got passed along with the stimulus bill, and it provided equal coverage from health insurance companies for mental health and addiction treatment as they cover other medical diseases. So that was a real breakthrough. Another change that I've seen with the stigma is that it's no longer taboo to take antidepressants if you're in recovery. Back in 1990, you couldn't even talk about it. It was considered something you just don't do that. And now, it's a very common thing, and everybody doesn't need it, but it helps a lot of people, and other medications. And so that's a good thing once you've tried everything behaviorally and are still not getting the results and the ability to live your life to your fullest potential. There's much more available to us now. So some of the barriers to treatment that I come across in my work as a psychologist, I work with individuals, couples, and families. Some people are in recovery, some are trying to get in. But the major themes that I see in the barriers are the family dysfunction. Probably pretty much all of us have had some kind of dysfunction in our families, but it's more so in families with mental health problems and addiction. And that can really keep you stuck into a sick system that's hard to get out of. And along with that, there can be a lot of shame and denial, minimizing. It's not that bad because I compare myself to that person, and that person is always much worse than I am, so I'm still okay. The minimizing and the rationalizing, these are all the defense mechanisms that we're up against in the treatment world to try to help the person to break through the fogginess and the lens of all of these defenses so that they can begin to see the truth of their own lives. It's not necessarily an abstract lecture about what can happen to you. It's let's look at how your life is working and what's happening in your own life and what do you really want. First responders have a very special place in being a bridge to people finding treatment. You can refer, and you do all the time, to hospitals, to treatment centers. Hospitals will then refer to treatment centers will then refer to therapists and other treatment centers, and all down the line. And so you're, as first responders, at first point of contact. The person who's responsible for me getting sober was a first responder. It was a policeman who arrested me for DWI back in 1989. And I thank God for that person, whoever it was. I don't remember him because I was in a blackout when I got arrested, but that saved my life. And I'm grateful every day for that first responder. You'll often see a cluster of issues all at one time. You'll see substance abuse much of the time, but that can also be intertwined with any number of mental health disorders, such as bipolar disorder, narcissistic personality disorder, borderline personality disorder, anxiety and panic attacks, depression, trauma and PTSD. All of these things are often intertwined with substance abuse, but you don't know really what you've got until you treat the substance abuse first. So that's always the first order of business. And then usually after about 6 months, you can get a clear picture of the underlying diagnoses and what they are and what to do next. But it can be very confusing when you have someone who looks ADHD or bipolar, but they're really on cocaine and they're all over the place and they can't calm down. So it can be very confusing for first responders and clinicians and therapists, and so it just takes some time to sort that all out. It's a long process. People don't get sick overnight and they don't get well overnight. But the starting point is to get the drugs and alcohol out of their system, and then you can have a good idea about the other conditions. The next piece is the aftercare, after treatment. This is probably the most important part of the treatment process because most people can clean up and get well if they're in treatment. If they're in inpatient treatment, they're locked up, so it's even easier. If they're in outpatient treatment, they have the responsibility to get themselves there and get home every day. But they still have a lot of structure and support and community, and so it's much easier. It's when they leave treatment that the real work begins, because then they have to learn how to be well at home, in their lives, working with their families, with their dysfunctional relatives, in their difficult marriages, all these things that they have to deal with. And so the aftercare usually consists of a combination of things, usually 12-step meetings if there's substance abuse, group therapy, individual therapy, medication management, nutrition management, sleep management, and exercise is another really important part of early recovery because it rebalances the person and elevates the level of the feel-good chemicals that the body makes. The first phase of recovery is mostly physical. It lasts about 2 years. It's called post-acute withdrawal. After that, from about 2 to 10 years, you have a lot of emotional and psychological deeper recovery. And then beyond that is the spiritual growth that is ongoing, and it never, ever, ever stops. And I can honestly tell you now, I'm in my 37th year of sobriety. I am a completely different person than 1 year ago because of all of the growth that I've had just in the last year. It doesn't just happen to you on its own. You have to do your part. So it's really important, no matter how long you're in recovery, to stay engaged in the process and to keep on working on yourself, because we're always presented with new challenges and situations and ways to develop our character and grow. And if there's anything that is most important in remaining well, staying well, it's ongoing character development. Lastly, I'd like to just give a word to the first responders about how important it is for you to take care of you. We who are drawn to taking care of people and helping professions, we tend to be codependent personality types, and we can lose ourselves in other people. We can lose ourselves in helping. So the most important thing for first responders is first take care of you. And this means very simple things: eat a nutritious diet, rest well, have your own support system, limit caffeine, especially if you're on shift work. It's going to be really tempting to jack yourself up on caffeine. That can burn out your adrenals and leave you more depleted as time goes on, and it can double your risk of a heart attack. Also, exercise, nutrition, have a lot of social support. Make sure you have fun, because that's an important part of life that we can't forget. And lastly, try to find some sort of a spiritual life. Something that fits you, that you can spend just a little bit of time each day for yourself, because sometimes there is no one to talk to and there's no one to turn to. And having a spiritual life always gives you something that's there for you. Thank you very much.